Hello Pharma friends, welcome to GDC online classes, and in this session we will discuss regarding the urinary antiseptics. The drugs helps in the treatment of urinary tract infections or any urinary tract related other illness. These drugs are acts as a antiseptics, and you already know that GDC GPAT Discussion Center started classes in English especially for the South India pharmacy students regarding GPAT, NIPER, Drug Inspector, Pharmacist and other pharma computer related exams. So you can go to YouTube and type as a GDC English classes and subscribe to GDC English classes YouTube channel regarding updates. So you already know that from July 15, 2024, the GPAT coaching starting for 25 and 26 batch, that is 2025-2026. And let's see here the discussion on the urinary antiseptics. The discussion is on the urinary antiseptics. Wait a moment. Okay. Yes, everything is okay now. Wait a moment. Okay. So sorry for a little bit inconvenience. And here, so what are urinary antiseptics? So what are the examples and what are the mechanisms? And it starts with urinary antiseptics. So these are the drugs used to prevent or treat urinary tract infections. The organism involved in the development of urinary tract infection. Generally, urinary tract infections are upper urinary tract infection, lower urinary tract infections. So lower urinary tract infection means leads to urethra, urinary bladder, and upper means related to the kidney, ureters. And the organisms like 𝙂𝙀𝙎, Escherichia coli, a gram-negative organism, Proteus mirabilis, Klebsiella pneumoniae, and Pseudomonas aeruginosa, one of the highly infective gram-negative bacteria. Okay, so these are the list of the organisms which can commonly cause the urinary tract infection, including lower as well as upper urinary tract infection. So these are the list of organisms which may cause this urinary tract infection, and these are more effective in acidic urine because low pH is an independent inhibitory of bacterial growth. High volume of distribution in body characteristic for an effective urinary tract antimicrobial drug. So an antimicrobial drug, to show action, it should be effectively distributed throughout the body, and these drugs are orally administered antimicrobial agents attain antibacterial concentration only in urine with no systemic antibacterial effect. So these are the drugs administered orally, and especially they attain concentration easily, fastly in the urinary tract and helps in the treatment of urinary tract infection, does not enter into the blood. So no systemic effect, no effect on the blood as well as other body organs. Okay, next. So here the urinary antiseptics are like there are mainly three drugs are here I mentioned. The examples like methenamine also known as hexamine chemically, and phenazopyridine, not pyridine, there is a spelling mistake, that is phenazopyridine, and nitrofurantoin. And first we will discuss regarding the methenamine. It is a hexamethylene tetramine, chemically hexamethylene tetramine. So containing 6 methyl groups and 4 amine groups, which is inactive as a such. Generally it is inactive, but decomposes slowly in acidic urine to release formaldehyde, which inhibits the bacteria. Nothing but the bacteria causing urinary tract infection. So generally methenamine, chemically hexamethylene tetramine, generally it is inactive in nature, but when enter into the urinary tract in presence of acidic urine, it releases free formaldehyde. That free formaldehyde having the antibacterial effect and kills the bacterium, causes urinary tract infection. And these drugs exerts no antimicrobial activity in blood as well as tissue, including kidney parenchyma. So mostly this drug does not exert antibacterial activity other than urinary tract. So exerts only action in urinary tract but not in other tissues as well as organs, including kidney parenchyma. That's why these are the drugs known as urinary antiseptics. Specifically shows action on urinary tract, especially lower urinary tract. Kills the bacterium which can cause urinary tract infections. Next, acidic urine is essential for its action. So, if these drugs to show antibacterial action, presence of acidic urine is essential. In the presence of acidic urine only, these drugs active and shows antibacterial action in the urinary tract infection. Urinary pH must be kept below 5.5. Urinary pH must be kept below 5.5 by administering an organic acid which excreted as mandelic acid or hippuric acid or ascorbic acid. So here methenamine is a prodrug in acidic pH around less than 5.5 releases formaldehyde which shows antiseptic, nothing but kills the bacteria. So methenamine, that is hexamethylene tetramine, in presence of acidic pH less than 5.5 converts to free formaldehyde plus ammonia. That free formaldehyde having antiseptic action inhibit the bacteria. The major adverse or drawback of this methenamine is gastritis, inflammation to GIT layer due to release of formaldehyde in stomach. So it is a prodrug. After reaching GIT, it may convert to active drug formaldehyde. That formaldehyde before reaching the urinary tract may damage the GIT and causes gastritis, inflammation to the gastric layer. And next drug is the another urinary antiseptic is nitrofurantoin. It is primarily bacteriostatic in nature, stops the growth of bacterium, but maybe cidal kills the growth of bacterium at high concentration in acidic urine because its activity is enhanced at low pH. Here meaning of low pH means acidic pH. If high pH means basic pH. Okay, so nitrofurantoin generally bacteriostatic, stops the growth of bacterium, stops the cell division in bacterium, but at high concentration kills the bacterium bactericidal. But at high concentration, these drugs may show side effect, adverse effects in body. And even antibiotics like penicillin, cephalosporins, many antibiotics, they should show excellent action at minimal doses because at high doses they shows side effects. Next, so the continuation, nitrofurantoin well absorbed orally, rapidly metabolized in the liver and other tissues, less than half is excreted unchanged in urine, and the plasma half-life is 30 to 60 minutes. Plasma half-life 30 to 60 minutes. In susceptible in susceptible bacteria, nitrofurantoin converts to highly reactive metabolite. Nitrofuran converts to highly reactive metabolite. That highly reactive metabolite damages the bacterial DNA and negatively affect the bacterial population, decrease the bacterial population, decrease the survival of bacteria, and helps in the treatment of urinary tract infections caused by organisms like Escherichia coli, Proteus mirabilis, Klebsiella pneumoniae, etc. and also Pseudomonas. Next, phenazopyridine. Next is phenazopyridine. It is an orange dye compound, phenazopyridine. It containing phenyl group, azole ring, pyridine ring. Phenyl azo group means to the phenyl group azo link, N double bond N. And pyridine. So phenyl azopyridine, it is a orange dye, exerts analgesic action, means decrease the pain, reduce the pain in urinary tract, and afford relief of burning sensation. So especially during the urinary tract there is a burning sensation, pain while urination, or maybe chance of blood through the urine. So during that there is a chance of pain. That pain can be controlled by urinary antiseptic phenazopyridine. It is a dye compound, orange dye color compound, orange color dye compound. It does not having any antibacterial property, so it does not having any effect on bacteria. It just causes analgesia, pain relief, decrease the pain. And other drugs used in treatment of urinary tract infections like cotrimoxazole. Cotrimoxazole is a combination of sulfamethoxazole plus trimethoprim. It is a synergistic combination. So working together, these two drugs sulfamethoxazole as well as trimethoprim in the combination shows bactericidal action, synergistic action, mainly for treatment of urinary tract infections. Quinolines, quinolines and fluoroquinolines, which are the synthetic antimicrobial compounds, wide application, mainly inhibit DNA synthesis in gram-positive, gram-negative bacteria. Ampicillin, amoxicillin, chemically aminopenicillins, piperacillin, tecarcillin, also penicillin compounds. Cephalosporin, so many cephalosporin like first, second, third generation, and fourth and fifth. Zentamicin, a aminoglycoside naturally derived from organism Micromonospora purpureae. Chloramphenicol, a protein synthesis inhibitor naturally derived from Streptomyces venezuelae, acts by binding to 50s ribosomal subunits in bacteria. And tetracycline, so tetracycline is also same protein synthesis inhibitor in the bacteria, acts by binding to the 30s ribosomal subunit, acts by binding to the 30s ribosomal subunits. Next, so here drugs useful in treatment of sexually transmitted disease. So the name itself indicating STD, sexual transmitted disease. These are the disease caused by sexual interaction. For example, if two persons are participating in the sexual intercourse, reproduction, one person may get from the other person if opposite person having particular type of sexual transmitted disease. So mostly, so this disease because of sexual interaction with the persons suffering from the infection, and anal, oral, vaginal sex, and one person having sex with multiple person, and even from mother to child also during the pregnancy there is a chance of spreading of STD diseases. So here just four types of STD and their treatment with particular drugs. First, gonorrhea. That is, gonorrhea is one of the type of sexual transmitted disease. Gonorrhea is caused by Neisseria gonorrhoeae, a type of gram-negative gram-negative diplococci. And drugs like ceftriaxone, here there is a F is missed, ceftriaxone, cefixime, a cephalosporin compound. So cephalosporins like penicillins, they inhibit the cell wall synthesis in the bacterium. Next, syphilis. Next is the syphilis. Syphilis is caused by Treponema pallidum, a spirochete, spiral-shaped bacterium. So syphilis nothing but syphilis is caused by Treponema pallidum. And drugs like benzathine penicillin, a sustainable release penicillin, depot formulation, slowly released formulation, and doxycycline, a commonly used tetracycline. Next, granuloma. The drugs for treatment of granuloma like common tetracycline, doxycycline, and azithromycin. Azithromycin is a macrolide compound. It is a macrolide inhibit protein synthesis in the bacterium. by binding to 50s ribosomal subunit. By binding to 50s ribosomal subunit. Okay. So here the drugs for treatment of granuloma inguinale. So it is also known as. So just wait, I will select the sketch for you to clearly visible. So granuloma inguinale, also known as donovanosis, a genital means reproductive organ, genital ulcerative disease caused by the intracellular gram-negative bacterium Klebsiella granulomatis, formerly known as 𝘂𝙬𝙎𝑚𝑎TOBACTERIUM granulomatis. Okay. Next, concroid. So concroid, the drugs like ceftriaxone, azithromycin, and cancroid, also known as soft cancre. Cancre means a ulcer, a reddish skin like ulcer. Cancroid is a bacterial infection caused by Haemophilus ducreyi. Cancroid is considered as a sexual transmitted disease, nothing but formation of ulcer. So where the cancroid is in the body, there is a formation of ulcers like wounds, like sores, means the wounds with reddish nature, reddish color, like reddish color tissue, inflammatory tissue. So these are the list of the sexual transmitted disease and the drug of choice. Next, drugs for treatment of nothing but anti-pseudomonal agents. So here these are the class of drugs effectively working on the pseudomonas. Pseudomonas aeruginosa is one of the gram-negative bacterium which can cause infections in the human body, and it is highly infectious in nature. Pseudomonas is an organism not easily inhibited by all drugs. And here some of the list of the drugs which can effectively shows their action on inhibition of Pseudomonas aeruginosa, one of the gram-negative bacterium. Sulfonamides like silver sulfadiazine, mefenide acetate, topically useful. 𝘂𝙬𝙎𝙎𝙬𝙎, name itself indicating they are amino sugars, polycationic nature, having poor absorption and distribution through oral cavity. And drugs like zentamicin, amikacin, tobramycin, these are the drugs effectively for treatment of pseudomonal infection. The infections caused by pseudomonas, a gram-negative bacterium, Okay, and next, beta fluoroquinolones. So these are the synthetic chemical compounds having excellent action on pseudomonas like ciprofloxacin, levofloxacin. Beta-lactam antibiotics like anti-pseudomonal penicillin, carbenzylin ticarcillin, both are generally effectively on the gram-negative bacterium pseudomonas, and these are commonly known as carboxypenicillins. And cephalosporins like cefoperazone, ceftazidime, cefepime, carbapenems like imipenem, meropenem, monobactam like aztreonam. So both beta-lactam antibiotics means cephalosporins, penicillins, monobactam as well as carbapenems. All beta-lactam antibiotics common mechanism inhibit the cell wall synthesis in both gram-positive, gram-negative bacteria. If cell wall synthesis inhibited, then the bacterium will die. That's why all beta-lactam antibiotics are bactericidal in nature. They kills the growth of the bacterium. So this is simply the session on urinary antiseptic along with the drugs for treatment of sexual transmitted disease, and also the list of drugs showing effective action on the pseudomonas, which is one of the highly infectious gram-negative bacteria, can cause different disease in the human beings. Okay, so thank you.